Bone remodeling is just the reshaping of bone. In order to reshape bone, you need special cells called osteoclasts, which we've talked about before and we'll talk about in the repair of a fracture. So the last thing we're going to talk about is bone repair, right? So back in chapter 4, we talked about what happens when tissue gets damaged, right? And when tissue gets damaged, the first thing that happens is swelling. Okay? Same thing when bone gets fractured or when bone breaks, the very first thing you see is swelling. So there are 4 steps to bone repair. The first one is called a hematoma, and this is swelling. The second stage is the formation of a cartilaginous callus. This third stage is the formation of a bony callus, and then the final stage is reshaping or remodeling the bone. So as mentioned, the first stage is hematoma. Hematoma. There you go. So as I mentioned before, hematoma is swelling. So why do we want swelling into an area? Remember, swelling is a good thing. Swelling brings blood. Blood carries red blood cells, white blood cells, everything to help heal that tissue or begin the repair of tissue. So what happens in a hematoma? Obviously, you've broken the bone, which means you've broken blood vessels. Now, one thing you have to understand is that bone is very vascular. In other words, it has a great blood supply, which means bone will heal faster. So the second stage of bone repair is cartilaginous callus formation. So what happens in cartilaginous callus formation is that the blood clot is replaced by fibrocartilage. Right? And the reason why it's replaced by fibrocartilage is very soft. And fibrocartilage allows blood vessels to reconnect. Because it's so soft, blood vessels can kind of snake their way through the cartilage and reconnect. Fibrocartilage also provides a scaffolding or a framework for the next stage, which is bony callus formation. So now bone will replace the cartilage. Again, you'll see reattachment of the blood vessels. And then finally, the last stage of bone repair is what we call remodeling. So what happens is you have this large callus, right? This large bulge that sticks out. And what happens is remodeling is the reabsorption of that callus. Right? And the reabsorption or the destruction of that excess bone occurs by cells called osteoclasts doing that kind of work. Okay? They actually reabsorb and destroy that bone. So that reshapes the bone.